Joining me is Dr. Joel Selanikio. He's an award-winning physician and the CEO and co-founder of Magpi. You punch into Google, robots and healthcare articles. I was just looking today. I could still be looking at this stuff. I mean, there's a million of them. Some of the headlines: the future of healthcare is robots. AI and robotics are transforming healthcare. Is that hype or is it real?
No, I think it's definitely coming. There's no question about it. The question is, how fast is it going to come, and where is it going to come first? Who's going to dominate?
Is it going to be diagnosis? Is it going to be in the surgical sense? I mean, are we going to see it across healthcare? I mean, where do you see it? What's your vision?
Well, I have to tell you, I mean, I've seen lots at this point, lots of research and some commercial products that are beginning to commercialize the sort of pattern recognition AI, like looking at x-rays and diagnosing what's on the x-ray as fast and as well as a human doctor, or looking at other images, or sometimes listening to sounds like the sound of someone breathing and diagnosing pneumonia from that. I was a little surprised. I hadn't seen as much in the surgical sense, but even right here in Washington, a team at Children's National Medical Center has been working on an actual AI-driven robotic surgery system. It's very, very basic at this point, but essentially it is able to sew up a wound self-directed. Now, this is, it's pretty small potatoes when it comes to the kind of things you have to do in the operating room, but it's a beginning. And so the pattern recognition stuff is going full force all over the place. China, the United States, the European Union, lots of people moving ahead. The surgical stuff where you're combining kind of an AI intelligence driving something with an actual machine that's operating something like in the operating room, that is a little bit further behind.
I've got a friend of mine who's got a son in medical school, and I'm sure he's ready to just jump out a window right now. I mean, you spend so much money. I mean, this seems like the one field that you're not going to be impacted. I was having a conversation about robots with my wife this morning, and she's like, I don't want them cutting on me. I mean, are people going to be comfortable going into a surgery thinking that there's some kind of machine involved in all of this?
Mike, I think a lot of people are not comfortable just getting cut in the first place.
Well, that's very true.
So, people say that in the same way they do surveys and they say, would you be comfortable using an AI doctor, whatever that means? Now, first of all, most of the people responding, there's no real definition of what is an AI doctor. Is that a robot in human form, talking to you in a mechanical voice and diagnosing something? Or is it something you do on your smartphone? So without a definition of it, I think people can't really give a good answer to that question. Also, healthcare in the United States is so expensive, so inconvenient, so complicated. I think if they come up with ways, for example, that you could, for minor illnesses at first, look into a smartphone, breathe into a smartphone, talk to your computer, get a diagnosis and a prescription without having to go wait for 2 hours in the emergency room, I think people will start to change their mind about whether or not they're going to allow, they will be treated by an AI doctor or a robot doctor, whatever that means. So I think these things are starting to come into the hospital now, and it's kind of just like everything else. It comes in slowly. We don't even realize it's happening. Your life as a consumer, mine as a consumer, is already completely suffused with AI. Not just Netflix recommendations, but GMAT scoring is partially done by AI. Likewise for the SATs. Sales, your restaurant choices, the kind of advertisements you get. We're surrounded by this kind of AI stuff. It's really, it's not that medicine is kind of on the cutting edge. Medicine is sort of running behind retail and just starting to get these same processes in place. But it is really going to affect the whole system.
You said we don't realize it. I didn't realize it. I was looking at the Da Vinci surgical system. The first robotic device to be used in surgical procedures was introduced in 2000. There's been more than 20,000 surgeries. I think a lot of people aren't even aware that that's going on.
It's true, but keep in mind that the Da Vinci system is driven by a human surgeon. So a human surgeon, he or she is essentially using that to make finer movements and hopefully to cut down on errors, et cetera. And there's lots of work being done to allow human surgeons to operate more effectively using systems like Da Vinci. What Da Vinci doesn't do is it doesn't do surgery by itself. But people are working actively on systems that will allow, for example, at this point, we have AI that can, let's say you had a simple straight laceration on, you cut yourself on a piece of glass on your arm, that can look at that wound, identify the edges of the wound. We have AI that can do that, that can define, that it knows what's the wound and what's the intact skin. We also, I think, are really close to having AI that can look at that and then say, great, let me go ahead and put some stitches in. I mean, this stuff is not, you know, the far, far future. This stuff is coming in the next 10, 15 years.
Are we going to have healthier lives as a result of it, do you think? Or should we be, you know, there's this fear everyone has of robots and AI, you know, they're going to take our jobs, it's going to be this encroachment. Should we be looking at it differently?
Well, you know, I give a lot of talks about AI in healthcare, including to groups of doctors. And I will tell you that it's very interesting. When you give AI talks to a group of doctors, you could separate the group into two distinct subgroups. There's the guys who have some gray hair like me, and those docs, they're kind of like, oh, this is really interesting. AI, it's going to take some doctors' jobs, it's going to move into healthcare, et cetera. But you know what they're really thinking is, well, that's okay, because I'm going to be retiring soon, et cetera. Then you look at the younger docs, the docs who are still in residency or just came out of residency, and they recognize this is really a threat to their jobs. So what you'll see online is you'll see articles that say, oh, it's ridiculous, you know, AI is not going to get rid of all doctors. It's just going to make doctors more efficient and productive. I think what the people writing those articles don't understand is that if you have doctors at a certain level of productivity, seeing a certain number of patients, and you make them more productive, it means you don't need as many doctors to see that number of patients, right? The more efficient doctors get, the fewer of them you need. So if you're talking about a country like China where there's a great deal of unmet need, that's great because you can use the same doctors to treat a much bigger population. In the United States, I'm not sure if that's the case. So I think we're going to see a lot more, we're going to need fewer doctors. We're going to see a lot more empowered physician's assistants, nurse practitioners, pharmacists who are able to do more of what's currently done by doctors. And I think as a result, I'm not sure if we'll be healthier. I know our wallets will be healthier. It'll be cheaper.
Well, Joel, it's great to see you, and it's also great to see a little bit of that gray hair. You don't have to worry as much as the young people. Thanks so much.